Welcome to CNTV. I'm Brad Clonch along with Quin Tran. The first people vaccinated for COVID-19 are getting their second doses this month.
We spoke with Dr. Charles Grimm about the vaccine and his outlook for these early days of 2021.
The cases continue to rise. The positivity rate in communities are high. We still have widespread community spread across the state of Oklahoma. Just in our hospital alone this week, we have so many now that we're starting to have to double bed some of them in the same rooms, which is basically our surge plan. We're starting to implement our surge plan because we have more patients now than we normally would treat. We don't have enough staff. When you start having to house more people than you staff for normally, because you're using more beds than you normally do, you start running into staffing issues. We run into staffing issues because our staff are getting sick with COVID too. One of the ways we've dealt with it is getting staff from our other departments to help serve in either our emergency department, ICU, or inpatient, serving COVID needs. And so that means we've closed down some of our, primary care clinics. It means that some of the surgeries that people would have that are not serious enough to have to be done, that are not urgent or emergent, are getting postponed. All of us are concerned that there might be long-term effects to that.
Dr. Grimm continues to stress the 3 W's: wash your hands, wear a mask, and watch your distance.
And he's encouraging people to get the vaccine. The COVID-19 vaccine starts to work 7 to 10 days after the first dose. Here's more on how it works.
How are they getting 95% efficiency? We know exactly what our target is. So they took that spike protein and they took the messenger RNA that could code to attach to that. And what they did was they stuck it in it's called a fat nucleus. It's a delivery system so that the body will receive it. So it had to have something to be stable, because you couldn't just take the mRNA and freeze it and then inject that into the body. It wouldn't be stable long enough to get it out of the lab. So what they had to do is they stuck it in this little fat molecule. It's got some fat and some sugars around it. The body receives that, and then when it gets in there and it sees that mRNA, it's like, hey, what is that? So your immune system basically just recognizes that and says, that's not supposed to be here. We need to remember what this is. Let's build a defense around it. And that happens with your first vaccine that you receive. When you have to get the second one, 21 days later, for instance, for the Pfizer, your body immediately knows what that is and says, hey, I've got that in my DNA code. I know what that is. That's bad. We need to attack it. And they are seeing titer levels get higher than they could have ever anticipated. And that's where they're getting their efficiency from. That's why these vaccines are showing 95% effective, is because they've got one target and they're just using the body's own defense to go out and target that virus.
What's your reaction as a pharmacist to having this as a tool to fight COVID-19?
Yeah, as a medical professional that has been dealing with this since March, our world has changed in the healthcare community. I mean, we are seeing people, unfortunately, have a lot of problems with this virus. Our hospital has been at surge capacity. We're overflowing everywhere, and it's just caused a tremendous toll. So to have this vaccine and multiple other vaccines coming down the pipeline, I see it as a true blessing from God. God has given the really smart people the ability to make this vaccine and to get us out of this pandemic that we're in. And so I hope people have confidence in that. And I know there's questions and some uncertainties, and that's okay. I understand that. And some people may not ever want to get that vaccine, but I really think the more we can get people to get vaccinated, it's just going to get us past this pandemic that we're in right here faster than ever.
We continue to follow COVID-19. Look for more from healthcare officials in upcoming episodes of CNTV. A new year is a great time to set resolutions. One of the top New Year's resolutions is to quit smoking.
A Chickasaw Nation prevention specialist tells us why now is the time to kick the habit and how best to do it.
I speak to so many people that have given up smoking tobacco for vaping. And now we're seeing so much research that's saying vaping is at least as dangerous as smoking. And to me, one of the scariest aspects of the vaping is that it's so attractive to young people, as young as middle school age. I'm seeing so many middle school and high school kids that think vaping is safe, and it is so not safe. Not only do you have the nicotine addiction, because the products all contain nicotine, but you also have that fluid. They're inhaling fluid into their lungs, and research is showing that that's doing a lot of damage. Probably the most nefarious part of the whole vaping thing to me, they're making them attractive to young people. They use, bubblegum flavor and gummy bear flavor and cotton candy flavor intentionally. The component that makes it addictive is the nicotine. Research is showing that some of those vaping liquids have as much nicotine in them as 20 cigarettes. We know that secondhand smoke is so dangerous for our kids and our pets. I still see people smoking in their cars. Even with your window cracked, that is not safe. They're still getting that secondhand smoke. They get it in their hair and on their clothes. And what a lot of people don't think about is even third-hand smoke. If you smoke on the way to see your grandbaby in your car, and then you get out and you go inside and you hold grandbaby close to you, that stuff is on your clothes, it's on your skin, it's in your hair, and we refer to that as third-hand smoke, and it is very, very dangerous.
What's the very first step people need to take?
When you decide to quit, you have to make a plan, okay? Don't just wake up one morning and say, oh, I don't think I'll smoke today. I have met a few people that are able to quit cold turkey, but I have not met a lot of people. It's difficult. Again, it's an addiction. So make a plan, set a quit date. And in the meantime, there are so many things you could be doing. Eliminate triggers, clean your car, clean your house, get rid of that cigarette smoke, wash your curtains if you have to, get rid of ashtrays, things that are going to trigger you. Tell your family members, right off the cuff, here's what I'm going to try to do, and I could really use your support. So if you have family members who smoke, ask them not to smoke around you. And the more things that you can think of in advance, the more successful you're going to be. Another thing, I've talked to people that have tried to quit and were not successful right away, and they get very discouraged and down on themselves, and oh, I'm just too weak, I can't do it. But give yourself a break, give yourself time. Slip-ups will happen. The average number of quit attempts to be successful and permanent is 7. So, just be aware of that. Don't beat yourself up. If you've gone, haven't had a cigarette in a month, and then something triggers you and you have a cigarette, just start back the next day. Don't beat yourself up and say, oh, I can never do this. Think about the successes. Think about the days that you didn't smoke. The cravings can be so strong. But if they'll just wait it out, most of those cravings only last 3 to 5 minutes. Be patient with yourself. You didn't become addicted to nicotine overnight, and you're not going to probably break that addiction overnight.
The Chickasaw Nation has programs to help. Just reach out. Send a message to the email address on your screen.
The Oklahoma Tobacco Helpline is another good resource. You'll be able to connect to free programs, resources, and counseling. We take you now to Kingston, Oklahoma. This is a look of the No Hunger Holiday event held in December. The Chickasaw Nation helped distribute food, toys, and books to 800 area families. The event involved about 54 volunteers that included Chickasaw Nation employees. Additional toys were also delivered to the Chickasaw Children's Village, Kingston Police Toy Drive, Enos Fire Department Toy Drive, and Ardmore Toys for Tots. Oklahoma's Main Street Business of the Year goes to the McSwain Theater here in Ada and the Enchanted Door in Altus. The Oklahoma Main Street Center, part of the State Department of Commerce, selected the 2 winners. Owned and operated by the Chickasaw Nation, the McSwain Theater is a favorite entertainment venue located in downtown Ada. Live musical performances and other community events have been held at the McSwain over the years. Last summer, the McSwain Theater celebrated its 100th anniversary with a virtual show. Go online this month to enjoy a winter showcase featuring JL and the Crossover Band. Visit McSwainTheater.com.
This bundle of joy is the first baby born in 2021 at the Chickasaw Nation Medical Center. Jariah Whitebird was born at 4:04 in the morning. He weighs 9 pounds 4 ounces and is 20 inches. Alicia and Anthony Whitebird are his proud parents. Congratulations to this beautiful family. We'll make a virtual visit with them next month.
We want to let you know about an upcoming event to help show gratitude to healthcare workers in the community. Honk for Healthcare Heroes is set for January 23rd at 7 p.m. at the Chickasaw Nation Medical Center and Mercy Hospital in Ada. Show your appreciation in the drive-thru event. A thank you to healthcare workers who have served tirelessly during the pandemic.
We appreciate them so much, and we thank you for being with us. We'll see you next time here on CNTV.